Newborn jaundice, also known as neonatal jaundice, is the yellowing of the white portion of the eye or skin occurring or passing out pale stools in babies less than 1 month old. The disease is common in Ghana, where records shows that every day there are neonatal jaundice cases recorded among newborns at the Child Health Outpatients Department of the Kolebu Teaching Hospital in Accra. Mothers who do not attend antenatal care are at the highest risk, according to a study done by the unit. Professionals say, unfortunately, some mothers report to the health facility late, which later causes brain damage or even death, or a condition called cerebral palsy, which affects the movement of the child.
When neonatal jaundice, so first of all, we have to understand what a neonate actually is. So a neonate is a baby between the ages of 0, so for like the first day of life, to like the 28th day of life. That's within the first month of life. That's the neonate. And for jaundice is a condition that occurs when there's an increased level of bilirubin in the bloodstream. And for neonatal jaundice is basically jaundice found in a baby between the age of 0 and 28 days of life.
There are several conditions that cause neonatal jaundice. For instance, an infection in the baby, glucose 6-phosphate, dehydrogenase deficiency, differences in blood group of the baby and mother, binary atresia, and galactosemia, which is the accumulation of glucose in the blood. Breast milk jaundice also exists, but that is not common among Ghanaian children. According to pediatrician Dr. Ruth Badu, there are also some known specific causes and kinds of neonatal jaundice.
So what happens in the body is that when red blood cells are used and they are broken down, they eventually produce a chemical in the body called bilirubin. And when bilirubin is increased, then we have a condition called jaundice. So what happens is that the bilirubin is excreted in the body by the liver, and in babies the liver is not fully matured and fully functional to be able to excrete these increased levels in the body. Yes, so usually you have them presenting with jaundice. And for jaundice, one of the ways that you can see that a baby has jaundice is if the part of our eye which is white becomes yellow. Yes, and so when you see that, you should suspect that the baby has jaundice. And also sometimes the body of the baby actually becomes slightly yellow to the point where you press it, you may even see a different color, and then it returns to the yellowish color. So when you see that, you should think about jaundice and make sure that you report to the hospital as soon as possible.
Health practitioners advised early reporting at health facilities for early treatment, as the condition can go a long way in damaging the brain of the child. It is, however, not advisable to use herbal medicines, as in most cases exposes the child's brain and can lead to death. The condition is, however, preventable and treatable through surgery, phototherapy, and transfusion.